Hello and welcome to Good Morning America Health. I'm Meg Oliver. For patients suffering from disease and illness, very often their needs extend beyond the confines and capabilities of traditional medicine. Enter the very important field of palliative care, which seeks to alleviate pain and stress in patients. Results are often remarkable. Joining us today with a closer look at this is Dr. Christopher Magovern. Thanks so much for being here.
Good morning, Meg. Great to be here.
So compassionate care is nothing new, but the field of palliative care is relatively new. Explain it for us. What is it exactly?
Sure. Palliative care, reduced to the most simple level, is just the practice of trying to alleviate suffering and improve the quality of life. It's a little different than what we think of traditional medicine. Traditional medicine is the idea of curing disease and prolonging life, and that's what we've been taught in medical school. And an example may be grandma who comes down with lung cancer. Traditional medicine teaches us to do everything we can to treat her. Surgery, radiation, chemotherapy. We need to make her live as long as we can. But if grandma doesn't respond to these therapies and is now beginning to die, we now learn that we just take it easy and make her comfortable. We do everything we can to make her comfortable. The concept of palliative care is, why do we need to wait until grandma is dying to make her comfortable? Why can't we make her comfortable the minute that she's diagnosed with cancer? Why can't we make her comfortable while she's being treated for cancer? That's really what palliative care is all about. And the one misconception with palliative care is that we stop treating grandma. We don't treat her anymore. That's not true. We continue to treat patients, but we make them comfortable and we improve their quality of life.
Now, you mentioned lung cancer. My father passed away from lung cancer, and in the final stages he was in hospice care.
Yeah.
Many may confuse that with this, but this is very different.
Meg, that's a fantastic question, and everyone confuses the two. They're different. They both have the common theme that they try to reduce suffering and improve the quality of life. But hospice care really is a type of palliative care that is specifically designed for patients that are about to die. They're only for terminal patients. It's terminal care. These patients can't get into a hospice unless they get a letter from 2 doctors saying that they're unlikely to live for 6 months. So these patients are accepting the fact they're going to die. They're not interested in any further therapy. It's really comfort care. Palliative care, on the other hand, really is not intended just for patients that are about to die. It can be used for any patient with any stage of any real serious medical condition. It may be appropriate for a newborn baby that's born with birth defects. It may be appropriate for a teenager that's been in a car accident, has a spinal cord injury, and is paralyzed. And the whole idea is that we continue to treat the patient, but we're going to make sure their quality of life is good. Now,
there's a new study out from the New England Journal of Medicine saying that when you team up palliative care with traditional medicine, you see remarkable results. Tell me a little bit about it.
That's exactly right. This was a fantastic study. This was out of Boston, out of Mass General. They looked at 150 patients with advanced lung cancer. These patients were sick. They were unlikely to survive a year. And they divided these patients into 2 groups. One group of patients received traditional cancer therapy, chemotherapy, radiation therapy. The other group of patients received standard cancer therapy plus aggressive palliative therapy. And what that means is that they met with a team of doctors, nurses, social workers early on in their disease. And this team not only treated their disease, but they worked on trying to improve their quality of life. They met with them and communicated with them about the type of disease they had, what the prognosis was. They made sure they weren't suffering. They supported them psychologically, emotionally, and spiritually even, and they did everything they could to make life easier. And what they found after a couple of months was that these patients that were exposed to palliative care did better. They were less depressed, they had better quality of life, and the amazing thing is that they lived longer. They weren't trying to get these patients to live longer, but by improving the quality of their life, they lived longer.
Okay, so it seems like a no-brainer. Why don't you use it with all patients?
You are absolutely right. It is a no-brainer. We should use it with all of our patients. But the problem in medicine today is that we become so specialized. We have kidney doctors that focus on the kidney. We have lung doctors that focus on the lung. And we don't treat the whole patient anymore. I'm a heart surgeon. And I've been trained and I've been programmed to cut and sew. That's what I do. And I probably don't do a good enough job taking care of the whole patient, but we should.
So there's this larger debate now in the medical community. Should you introduce more curriculum to address this in medical school? Are they doing enough there?
They absolutely are. And when I went to medical school in the 80s, there wasn't a mention of this whatsoever. But now all medical schools have part of this in their curriculum. And furthermore, There are programs that train doctors to do this. There are palliative care medicine fellowships. A few years ago, there were only a handful. Now there's 74 different places in the country where you can learn to become this sort of doctor.
All right, before we go, so what's the perfect harmony in your book between these two ideologies?
Well, it's going to have to be some sort of balance. We can't go all palliative care, all traditional medicine. Because traditional medicine saves lives, and it works. You can't fix a hole in the heart, you can't repair a leaky valve with palliative care, but we do need to find some balance, and we're headed in the right direction.
Boy, what a hopeful study, though, to come out and to hear about this stuff. This is
It
great.
is.
All right, thanks so much for being here. We appreciate it. And for more on the latest in the world of medicine and wellness, head to the health page at abcnews.com.